This is your Houston chiropractor, Dr. Gregory Johnson. We have Jose in here with us. Jose brought his wife Miriam here, and they came all the way up here from Baytown, which is a southeast suburb of Houston. That's a lot of the oil and gas industries down there, huh?
Sir.
Yep. And Jose's been complaining over the past several years of lower back pain due to herniated disc that he had back in what year?
2012.
2012 was diagnosed. And he does not have radiculopathy or sciatica or paresthesia or numbness or tingling or anything like that down his legs or loss of strength or anything. His orthopedic test did show his legs were even, and his left leg got short when I brought it up, and that tightened up in his lower back. So that does indicate a sacral deviation on the left. So we're going to do his posture and then adjust him for you today too. Let's have you flex your head forward and backwards for me. We see a lot of patients from South Houston, Katy, Pearland, Baytown, Galveston, and then north of town too, Tomball, the Woodlands, Spring. Okay, let's go ahead and lay on your tummy for me there, Jose, and we'll get you adjusted. Now see, his legs start off even, but when I bring them up, see how the left one gets shorter, and then that tightens up a little bit in your lower back, doesn't it, Jose?
Yes.
And that's probably a little tender right there. That's the left sacrum. And just because you have a bulged and/or herniated disc does not mean you have to have back surgery. In fact, that's just the opposite. I could actually take 8 out of 10 people walking around out in the hallway here today and shoot MRIs on them, and I would probably find 8 out of 10 of those people would have a bulged and/or herniated disc, and they might not ever even have pain. There we go. You felt that one, didn't you? So just because you've got a bulged and/or herniated disc does not mean you need to have surgery. In fact, I think that's totally a last resort, and that's only if you're having bladder or bowel dysfunction. Okay, tighten this up. Now, Jose wasn't having any pain in his cervical spine or mid-thoracic spine, but I'm adjusting them all the same. Okay, let me check your leg length again. Still even down here. Let's see if they stay even this time. Yes, they do. Did that feel less tight that time?
Yes.
Good. Okay, let's turn you on your back now, please, sir. There we go. So Jose and Miriam are doing the right thing. They're actually coming in here and getting adjusted for posture and biomechanical reasons. Slide down this way. No, we'll just slide down there. Put your arms straight out to the sides for me. And they don't really have a lot of pain, which is the best time to get a chiropractic adjustment treatment. It's preventative rather than waiting until you've got degenerative disc disease, osteoarthritis, or degenerative joint disease, which is also known as osteoarthritis. Okay, you can relax your hands on your tummy. Let me have your leg. There you go. Felt that one from your knee up to your back, didn't you?
Yes.
Okay. Yep, good job. Okay, let's sit you up, face out the window here now. Or out face the wall, I mean. There we go. Okay. Keep your chin up too. See, both have a little tendency to see the dropping your head forward. You're keeping your head up now, though. That's good.
Yeah, it's not even hard to do.
Yeah, it's easier when you're in place more. You've had some trauma to this elbow.
Yeah.
You fractured. You fall on it or something?
Yeah. Yeah, broken.
Okay. Let's come over here on this table. I'm going to put your butt right there and hit up that way too. There we go. Get you in there nice and tight. Mary, you want to pull on his head this time? get a lot of husbands and wives coming in here. You want to play your Houston chiropractor on each other when they get home. I wouldn't recommend that. There we go. I got no say. You knock them out, I'll line them up. Yes, sir. Home run. Well, I bet he's still kicking. Yep. I bet you the decibel meter would be louder on me dropping the pins in the cervical. I don't know. Maybe not. There you go. Good job. Feel that all the way through, didn't you? Yeah. Okay, let's kind of get up sideways now, and we're going to have you stand over here in front of the mirror for me. Yeah, see, he's standing up taller right now, too. Let's have you flex your head forward and backwards again there for me now. Take a look at that, Jose. Pull your shoulders up and back. Flare these guys here. Okay, now see your head's a little forward and tucked in, so we're going to bring it back and then look at the wall behind you. Yep. You feel that all the way down your lower back extension. Okay, now relax. Now this time when you go forward and backwards, tell me if you feel any difference in how this feels versus the last couple that you did.
Smoother.
Smoother? Good. Take a look in the mirror. You're right down the middle everywhere. How do you feel after your first adjustment?
Feel a lot better than before I came in.
Was it what you expected after watching our YouTube videos?
Yeah.
Should have been exactly what you were expecting.
Exactly.
Hopefully it exceeded your expectations.
It did exceed.
It's better to get it done in person, huh?
Oh yeah.
Very good.
It's nothing like watching it. You gotta experience it.
To feel the real deal, huh?
Exactly.
Well, thank you for sharing your experience with everyone, Jose, and you guys driving all the way up here from Baytown. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in North Houston. We'll see y'all soon.